Good morning. This is Pamela Badalato with Mainline Parent, and I am here today with my editor, Laura, and Dr. Hazel Ginto from Bryn Mawr Hospital. She is the site chief for pediatric emergency medicine, and she's joining us today to answer all of your questions about summer safety, COVID and summer, and COVID and kids, and COVID and summer camp. Dr. Ginto has a special interest in quality and patient safety, and recently finished her Master's of Science in Healthcare, Quality and Patient Safety from Thomas Jefferson University. She's been with Nemours for 16 years and is the site chief for pediatric emergency services for Nemours at Bryn Mawr Hospital. She's also been the chair of pediatrics at Mainline Health for the past 5 years. Dr. Ginto is married with 2 daughters, a son, and 2 stepdaughters. She also has 2 cats and recently adopted a dog. In her spare time, Dr. Ginto enjoys traveling with her family and slowly crossing off national parks on their bucket list. She told me this morning she just returned recently from a trip to some of those national parks. So she is the perfect person to be with us today to answer those questions about summer and travel and our children. Dr. Ginto, thank you so much for being here with us.
You're very welcome. Thank you for the opportunity. I'm very happy to be here.
Okay, I guess to start off, we might as well go right into that travel question since you've so recently become more acquainted with it than the rest of us. So what should we expect? What will travel look like for those of us with children, both over and under 12 this summer? What's the safest way we can do that with our families?
Yeah, so the good news is travel now is safer than it's ever been since the pandemic started. And that's because of vaccination, right? So a lot of adults and, children over 12 years of age are now getting vaccinated. The issue still is any travel will require going to crowded places such as airports, train stations, where it's gonna be challenging to safely socially distance. So masking in those environments is so critical. I think a lot of us know by now that flying, in airplanes is not necessarily risky in terms of COVID because air in planes gets recirculated fairly frequently and air gets filtered as well. So it's not so much a quality of the air in the airplanes that's the issue. It's the fact that it's going to be difficult to socially distance. So it's very important to wear a mask and also make sure that you travel with easily accessible wipes and hand sanitizers. I mentioned I recently traveled with my husband and our daughter to Utah, and the flights were packed. They were absolutely packed. The good news was the airline I traveled, the flight attendants and even the pilot made it very clear that masking is required. And they made sure that everybody knew how to wear their mask properly. And all the passengers were told that if you weren't wearing your mask properly, you're going to get called out. And if you took a nap and your mask was not on properly, they will wake you up and make sure that you put that on. So I thought that was a great thing that they did.
That's fantastic that the airlines are working that hard to keep everybody safe, especially in a place where you physically cannot socially distance unless you buy all the rows around you. Right. I know Laura had another question.
Yeah, so I guess about a little bit more local travel. Let's shift gears a little bit. So a lot of our readers have like summer traditions where they will rent a shore house with another family, like family friends, and get their kids together. Mm-hmm. So if all the adults are vaccinated, the kids aren't, is this a safe activity? Is there any way to get kids together safely indoors and sleeping over if not vaccinated?
Mm-hmm. So with vaccination, it's become very clear that even pre-vaccination, the risk outdoors is very low. So CDC cites a less than 10% risk of getting and transmitting COVID when we're outdoors. But experts who have weighed in say that the risk is actually much lower than that. It's probably closer to less than 1%. So definitely outdoor gatherings are safe without a mask. That's become very clear. In terms of indoor gathering, the CDC guidance right now is if the adults are all vaccinated and you are within your own household, we don't need to wear masks anymore. Now, we can presumably extend that to friends with whom your children have been you know, around with over this past few months. I think if they've been around with their friends or neighbors regularly, we can extend that to, you know, the CDC's definition of your household. So certainly, you know, renting a house at the shore with your close friends with whom your kids have been around with should be safe, as long as the adults and anyone 12 years and older have been vaccinated as well.
That's great. Considering that is definitely one of our family traditions.
Right. It's exciting to say, you know, this going back to normal is certainly, you know, starting to, you know, feel like it, right?
Mm-hmm. It really is. It's been nice to feel a little safer over the last few weeks and months since vaccination rolled out at the beginning of the year. Speaking of masks, with the state of Pennsylvania saying that the mask requirements will be possibly lifted by the end of June as we reach that magic number of immunizations given, what does that look like for the age set that's unable to get vaccinated so far? I know some people are saying they'll continue masking. Some feel guilty, like myself, going out without a mask while our children still have to wear it. Do you think that that will, you know, will we still see kids wearing masks once the state says it's not required anymore? What are the suggestions there?
Yeah, so Governor Wolf had mentioned that once adults in Pennsylvania, 70% of adults in Pennsylvania have been vaccinated, which at the pace we're vaccinating right now, they think we're going to achieve by end of August. He was planning to lift the masking mandate, right? So it's a very good question. However, the acting education secretary for the state made it very clear that even with this directive from the governor, the individual decisions of the school districts will still, you know, supersede that. So I think over the summer, a lot of our school districts will give us guidance as to what they're going to decide to do. I can understand why a lot of parents will be reluctant to send their kids without a mask to school, considering that 12 and under don't have the opportunity to get vaccinated yet. And even if we do decide to send our kids without a mask, you have to be prepared if their best friend, you know, is not wearing a mask. I think it's going to come down to families making an individual decision as to what risks you're willing to take. And my advice is to discuss this as a family and share your decision with your children so that they understand this is why we're doing this, you know, and then also let them know that some of your friends might choose not to have a mask, or we might choose not to have a mask, and why is that? But it's good to prepare them ahead of time so that, you know, you're able to, hopefully they're able to address questions that arise from that experience ahead of time.
Great. So rewinding a little bit before we get to school, we're getting a little ahead of ourselves. What's your advice for parents about sending kids to camp this summer? And are there certain kinds of camps that you think are safer than others, perhaps?
So again, going back to normal, right? And the tradition of sending kids to camp. And I know kids, you know, a lot of them, really, this is the highlight of their summer. As long as they spend most of their time outdoors, which is what most of the camps are set up to do, right? And I think in the era of the pandemic, a lot of the camps which have indoor offering centers, switching them outdoors, I think the risk gets minimized. And then in terms of sleeping, I would just make sure that they're making an attempt to make that socially distanced. You know, perhaps the cots will be at least 6 feet apart. And in areas where they cannot do that, such as in bathrooms, for example, perhaps ask the kids to wear a mask.
Okay, so let me just ask you a little bit more about that. So you had mentioned sleepaway camp. Do you think it's safe for kids under 12 who aren't vaccinated to go to sleep camp? And would you recommend any kind of quarantine period for the campers if they choose to go?
So it depends on where they're going. Most of the states now have such a low incidence of COVID that if you weigh the risk and benefit of sending your kids to camp, it might weigh more towards, you know, let's get them back to normal and send them. Again, with a caveat that during the daytime, they're going to be spending most of their time outdoors. And when they cannot socially distance indoors, that they should be required to wear a mask. In terms of quarantining, that's a tough one. You know, if there's no report of anyone who demonstrated COVID symptoms, I don't think there's a need to quarantine, especially if they've been there for a while. So if they're in camp together for, you know, a few weeks and no one's developing symptoms, then there's no reason to think that they might bring it home, right? Yeah.
I'm glad to hear that advice, because my children are headed to sleepaway camp this summer. And the directive from the camp was, you know, to be very, very careful the week leading up. They're requiring everybody to get a PCR test 3 days before drop off. And then they're going to also do a rapid test upon drop off, keep everybody outside and socially distanced till those rapid tests come back. And then kind of, you know, gradually remove some of the mitigations over the course of the first few days and week, just to ensure that nobody came in with symptoms or you know, a false negative or anything like that, just to ensure that the kids are as safe as can be and can stay for their full sessions. But like you said, it's good to hear that the chance of transmission with the outdoors is as low as we've learned it as it is. So veering more off of the last 18 months most talked about topic of COVID, and just in terms of general summer safety tips, we always hear some parents asking about, you know, the safest way to keep their children, you know, protected during the summer with different activities and you know, places to go. What would you say are your top summer safety tips, even pre-COVID?
Yeah, so I'm going to base my answer on the most common emergencies that we see in the summer. So dehydration definitely is one of them. So, you know, being outdoors in the heat, we always have to remind our kids to make sure that they hydrate, you know, and overhydrate, and carry a bottle with them, a bottle of water or other drinks with them all the time. And along with that, obviously, we want to talk about sun safety and, you know, trying to minimize time outdoors when the sun is really out and blaring, and that's going to be between 10 a.m. to 2 p.m. And when outdoors, try to stay in shade or wear a wide brim hat, right? And then I think we're going to talk about sunscreens as well. So, you know, application of sunscreens, you know, frequently is definitely recommended. And there's so many products out there with SPFs ranging from like 30 to 110. I saw that's the highest I saw the most recent time I looked at sunscreens. And anything above 50% probably doesn't matter. So any sunscreen 50% or lower. As a matter of fact, AAP's recommendation is even lower, it's 30%. But if you wanted that added layer of protection, 50% is way sufficient.
That's interesting that you say that. I had heard once before that anything over 50 was kind of just like extraneous, you know, unnecessary. And of course, it's always interesting, the price goes up the higher that SPF goes. So that should have been the first indicator that you probably don't need anything higher than 50. So we often see questions in our community group from parents about safe sunscreens. Some are firm believers in the mineral sunscreen application, while some hate it because of that ghosty look that you get because it doesn't really rub in. So what do you suggest? Is it the mineral sunscreen, the non-mineral? And what's safer about, you know, one versus the other?
Yeah, so I had an opportunity to look at this more closely because my niece asked me about this as well. My niece has a baby. So I have to say, having looked into this, that the mineral sunscreens are safer because they only have 2 ingredients, right? Which have been rated by the FDA as generally recognized as safe and effective, and that would be zinc oxide and titanium oxide. And just like you alluded to, the disadvantage with these are they're so thick, they're harder to apply, and often they leave, you know, a residue on your skin. So just to give you insight, zinc oxide is a primary ingredient in diaper rash ointment, right? So see how thick it is. But because of that, it's very effective in blocking UVA and UVB rays, and it's also quite safe. Now, everything else has ingredients such as, I have to write this down because I won't remember them, oxybenzone, homosalate, and tyrosine, which for now we have insufficient data as to their safety. They're also more allergenic than the other two safer substances that I had mentioned. And the biggest concern with these is we're not sure yet about their endocrine disrupting effects. So they definitely can have hormonal effects, but we need more information at this time. I'm really hoping that, you know, after all these research that we're focusing on with COVID, that somebody will look into this and actually give us good data as to their safety and efficacy.
That's
so
great.
I have to say the evidence weighs towards, you know, using mineral sunscreens at this point.
Thank you.
So this is a little bit of a different lane here, but we've talked a lot about physical health, obviously, and we had some questions also about mental health, both about like social emotional like regressions and how to re-socialize a child who is going back to school, or maybe someone who's so young they don't even remember what it was like before or have that basis for social interactions, you know, with preschool or play group or something like that. So what advice would you give for parents who are noticing that their kids are having issues with social interactions, and also like what warning signs would you look for?
Yeah, I think the best thing to do is to reassure our kids that it's okay to feel that way. You know, validate that it's normal to feel that way. I can tell you that's probably the biggest toll our children have experienced with the pandemic, right? That's why going back to normal, being able to go back to school and being able to, you know, hang out with their friends as well is so, so important. So validating their feelings, letting them know that it's okay to feel this way. You know, I feel this way because I haven't seen my friends for a while, and, you know, it may feel awkward, you know, the first few times, but with time, you're going to feel more comfortable. And the pace with which that happens can be different for every child. Somebody might take just a day, you know, to get comfortable interacting with their friends again. It might, in some kids, it might take a few months, and that's okay. So I think that's that constant reassurance that it's okay to feel strange once they start interacting with other kids again is key and important.
Okay, and to repeat, so do you see it mimicking like other issues where kids have trauma, and are there signs you would look for to be like, okay, this is not just typical, my kid is really struggling?
Yeah. So when kids start behaving like they're withdrawn, and they continue to refuse to go to school, you know, with young kids, you know, think about first, for those of you who've had kindergartners, right? So the first week is always tough for the kids because it's a new environment. But after a while, and that while could be like 1-2 months, they start getting comfortable, and you know that they enjoy being around other kids. So when that doesn't happen and a child continues to refuse to go to school, then it might be time to seek help. And school counselors are the first go-to because they're familiar with the school environment. They may see what's happening at school that you may not have lenses with as parents. If that's not sufficient, then outside counseling may be helpful as well.
And would you recommend like easing into it? Someone from our community said that they took their child to a museum this past weekend, and the child asked to leave early because they were just so overwhelmed. It wasn't terribly crowded, but compared to what he was used to, it was. So things like that, like how would you recommend dealing with that?
Yeah, the good thing with schools is, you know, especially for young children, class size is usually between 20 to 30, right? So it's still a smaller environment. And if that's still overwhelming, then perhaps speak with the teacher and the school counselor if your child can start with an even smaller group first. And I'm hoping that our schools will realize this and make arrangements for that to happen. But definitely doing it slowly might be helpful. So throughout the summer, having gatherings with your friends with smaller groups of similar ages might be helpful in transitioning young children into, the slightly bigger groups that they might experience in school. Mm-hmm. And, to your point, I'm really hoping that our schools will plan for the return to school even more intentionally, such as I recall when my kids started taking the school bus, they had that experience of riding the school bus ahead of, everyone else so that they knew what that was like. So I'm hoping that our schools will think about that and offer that opportunity in smaller groups before the school starts.
I hope they do too. That'd be my kids. 3 of my children we stayed home for cyber school this year. So it's been, a very long time since they've been inside, a regular school building, let alone around, that many other people. We went to an event over the weekend, outdoor event. And when we walked up, my daughter was like, I haven't seen this many people in one place in a very long time. And she was excited, not nervous, but you can tell that there are a lot of other younger children there who, haven't seen a lot of people or, babies or toddlers who were born during this time that were very clingy because they just don't know, how to socialize or what it's like to be around that many people. I do have one other question that kind of rewinds us a little bit to where we started at the beginning with travel. From a friend that just sent me a message. And she was asking me if we do take a trip, whether a road trip or an airplane trip, and are exposed to crowds while traveling or other, taking other public transportation or in museums, places like that. And we have children with us that aren't vaccinated. Do you recommend testing them upon return or, after, 3 days after their last exposure? I know we've, kind of veered away from some of that, testing after travel as the government has changed their minds on things. But is it still like a medically recommended thing, or should we just wait for symptoms, or what do you think?
Yeah, it's generally not. Even the CDC says that with travel within the US does not require testing or quarantining when you return. Traveling internationally is different, right? Because the rates of transmission in other countries is much higher than it is in the US right now. So for international travel, we're still required to get tested within 3 days of returning to the US and within 3 to 5 days upon return. But within the US, getting tested during travel is no longer required. Now, for some families, if you're worried, my husband is a worry word. He would always want to get tested. It has a lot to do with his work. He takes care of children with special needs. So he feels that it's incumbent upon him to get tested before he returns to work. So I think it's different for everyone, but in general, it's no longer required to get tested.
Well, that's good to hear.
Oh, sorry.
Go ahead.
Sorry. Go ahead. Okay, so just another question, I guess, about vaccinations for kids. We know we're working on it for kids under 12. Do you have any updates about how that's going, or when you think this might be approved and when we could see that, actually making a difference with our kids?
So what we're hearing is definitely before the end of the year and maybe as early as the fall. And they're testing it now in kids as young as 6 months. So I think the next wave of emergency use authorizations is going to be for 6 months to up to 12 years, just under 12 years of age. And, if you recall, that happened pretty fast for, the 12 to 16 age group. I think it was just less than 2 months when we got that approval after the 16 and older got approved. Having said that, we're always a lot more diligent and careful when it comes to younger children. So it's probably going to take a little longer, but we're hearing before the end of the year. That sounds really exciting. And just to clarify, Pfizer-BioNTech is the vaccine that is ahead of everyone else in terms of getting approvals for, the pediatric age groups.
Dr. Ginto, I think we're coming close to the end of our list of questions that we had for you, but I just wanted to give you one last chance. If there was any other summer safety tips, any other COVID information that you wanted to share with our audience that maybe wasn't included on our questions list for you.
Yeah, I just had one thought. So in the middle of the pandemic, as pediatric emergency physicians, we were very happy to know that we barely had any patients, right? Which means that, you know, quarantining and wearing masks definitely help in terms of transmitting viruses, which, you know, make kids sick in terms of having fevers and maybe having respiratory symptoms. So we're gearing up for a very busy fall because now that children are going to be around other children, who most of whom might not have been exposed to them before, in which case we're expecting them to have a you know, a magnified response to the viruses. I think it's going to be busy in terms of respiratory illnesses in the fall. So it's just a reminder to let's keep doing the, you know, the important things that we were doing during the pandemic, which is, you know, trying to you know, sneeze or cough in our elbows, trying not to touch, you know, high touch surfaces. And when we do, you know, carry that hand sanitizer with us all the time so that we're constantly hand sanitizing, because we know how effective it was during the pandemic in terms of reducing transmission of infectious illnesses, specifically viruses. So just a tidbit there.
All great information. Thank you again so much for being with us today so soon after returning from your own vacation. I'm sure jumping back into real life after all the travel you've done is no easy task. So again, thank you so much. And to everybody out there watching live now, thank you for being with us. And for anybody who's watching a recording of this later on today or during the week, thanks for tuning in. We will see you all soon. Thanks so much.
Very welcome. Thanks for the opportunity. Take care, everyone. Have a great summer.
You too. Thanks.